My brother actually picked up opiate addiction while he was incarcerated. And he actually died and he lost his life. At the time he was, sleeping in the first floor of my mother's house. You would think that someone who has experienced psychological distress, trauma in their childhood, the loss of a brother to substance use disorder, you would think that that individual would never pick up on substance use themselves. I am a father. I am an advocate. I am a husband. I am someone you know. I did my best at living a normal life. Never drank coffee, caffeine, alcohol, smoked cigarettes. I never experimented with marijuana, cocaine, etc. However, back in early 2007, I had a motorcycle accident. At the time that I was doing pain management and physical therapy, I actually developed a dependency to prescription pain medication. And so, that led into a life of addiction. I started off with, say, 4 Percocets at a time. At the height of my addiction, I was actually taking upwards of 50 Percocets a day. I never felt that what I was doing was wrong. Unfortunately for me, my addiction progressed, and as a direct result of my addiction, I started getting myself into trouble with the criminal justice system. I remember going to jail, I remember going to county lockup and experiencing withdrawal symptoms. And so you think about, where my addiction has gotten me, and sure enough, you think like, when I get out, I'm gonna do things different. I'm never gonna go back to using another pill. I think that feeling lasted about 6 hours after I got out. Somebody walked up and was like, hey, do you want some pills? And I was like, sure, why not? And I was off to the races back in my addiction. After a few months, I was back in front of the judge, back incarcerated. And I remember looking at myself, throwing up, I was a mess. And I said, Evan, you have to do something different, man. God, please, just help me do something different. My life has to change. If not, I'm gonna end up dead like my brother. I'm gonna be in jail for the rest of my life. Something negative is gonna happen. And about 6 months after that, I was released back out into the community. I didn't really have much of a life to go back to. I was sustaining my substance use disorder by selling narcotics, committing crime. That's not the life that I wanted to go back to. And I remember my girlfriend telling me, why don't you just take it one step at a time? Work on your GED. That's like a short-term goal, right? And as a result, after 2 years, I actually earned my associates in behavioral health and human services with highest honors. Currently, I'm a program manager at Mental Health Partnerships, and it is absolutely the most rewarding work that I have ever done in my life. Say hi. 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 When we talk about relapse, when we talk about recovery in general, I think a lot of people have an idea in their head that recovery is a linear process. That's not necessarily the way recovery works, right? So if you look at my story and you consider like the first time I got out of jail, I relapsed right off the bat, right? And so what I would say to the individuals out there, and especially to the family members, right? Don't give up on your family member just because they've experienced a relapse. There's a resilience about the human spirit. We can bounce back from almost anything. In my recovery, I'm not just simply recovering, I'm thriving in recovery. So I'm a first-time homeowner. My wife and I are raising our children. We're expecting twins. I have a rewarding job, a job that pays well. This is something that's completely opposite of the person who I was in the past, right? We need to get rid of the stigma and shaming people that they're never going to change, or they're just going to go into treatment and they're going to relapse. I encourage a lot of individuals out there that are recovering in the shadows to come out of the shadows and share your recovery story with people. Let people know you can recover. We can and we do recover from substance use disorder, and to step up and say I'm the evidence. Look at me, we recover, we thrive in recovery.